There have been concerns here in Korea that we're going to experience a so-called twindemic this fall and winter of COVID and the seasonal flu. Immunity to both has been waning, but the health authorities say the term is misleading and that they're taking precautionary measures. Health experts are also discussing when we can take off our masks indoors, as many other countries are doing. Shin Ye-eun has the details.
There are worries about a twindemic here in South Korea. A twindemic refers to a spike of COVID-19 cases along with the seasonal flu. While the chances of a person catching both viral diseases at the same time are low, if they do, the death rate doubles compared to a person who's only infected with COVID-19. Recently, we've seen the number of people with the flu increase. Back in September 2020, only 1 out of 1,000 people went to see a doctor for the flu. Now, this number has increased to 5 out of 1,000. COVID-19 infections have also increased by more than 36,000 in a span of just 24 hours. On Wednesday, nearly 94,000 cases were reported. But the country's health officials have clarified that it'd be misleading to call this situation a twindemic.
Recently, many media outlets have spoken about a multidemic or twindemic, but there's no such medical term. COVID-19 is a pandemic and the flu is not. Stats may suggest this year's flu has hit us harder than the last 2 years, but it's just come a bit earlier. We must take precautionary measures to stop further spread.
This expert asked people to get tested. There are both PCR and rapid antigen tests for COVID and the flu. With authorities high on alert over the spread of COVID-19, health experts say lifting indoor mask mandates would only be possible as early as next spring.
Countries that have lifted mask mandates everywhere have first checked if most of the population has been vaccinated and whether they have antibodies to fight off 80% of the virus. We should too. Then we can start lifting mandates at places that can easily ventilate, like schools. Once people have more antibodies, the country should allow people to take off their masks on public transport.
This health expert also said COVID-19 should be treated at all hospitals, just like the regular flu. She mainly pointed out that putting people with COVID-19 under self-isolation could be dangerous, especially during the flu season, as it's hard to differentiate the two with their similar symptoms. Shin Ye-eun, Arirang News.